Good morning, everybody.
Just like to check. So I'm Vicki and she's Karen, in case you can't tell. But I do think the opening remarks from President Clinton were particularly a good segue into this conversation with Karen, because I think this is a momentous time. And I have to say, I was looking at the bio in the program, does not do you justice. So you heard that she is the president and CEO of EmblemHealth. In full disclosure, I met Karen when she was president and CEO at the American Health Insurance Plans, and she did an amazing job when she was there. What is not in the program, which is one of the reasons why I love her so much and respect her so much, is she's listed among the 50 most powerful people in politics. She's constantly listed as one of the top women in healthcare. But there are a couple of things that a quote that I wanted to read from the New York Times, which seems apropos since we're here in New York. And it so reflects you in my estimation. In a city teeming with healthcare lobbyists, Ms. Ignagni is widely considered one of the most effective lobbyist. She blends a detailed knowledge of health policy with an intuitive feel for politics. So I have to say too that over the years I've worked with Karen, I have observed her in very challenging times. Particularly I'm thinking of the Affordable Care Act and a few other things. And it has been amazing to me to see how effective she is and how fantastic her leadership is. So I thought it might be good to start out with our group to talk about what are your leadership principles? How have you been able, particularly since we're looking at transitioning in change, how have you been able to do that? What are your leadership objectives and principles that you can share with us?
Thank you for the question. I think during these times, it's a very important question, and everyone in the audience leads their respective organizations. You don't have to have CEO next to your name to be a very effective leader, and that's what you want to unpack. Vicki, the one thing I would say, I'm executive chair now of Emblem. I'm really excited about that new movement. I chair the board, and I have the privilege of being more outwardly focused, which I'm really enthusiastic about. I have to dust off my ability to do that because I've been under the hood for 8.5 years, but it's such a privilege to be there. So in terms of leadership, I think all of us can relate that mission and clarity of mission is very important for successful leaders, I believe. And you have to believe in the mission. If you don't believe in the mission, you can't lead anyone anywhere, in my view. And you have to be able to succinctly and persuasively communicate that mission. I'll give you some examples. In our enterprise, our mission is to provide healthy futures for our members and our communities. When we started our transformation of EmblemHealth 8.5 years ago, we realized that we didn't have the technology that was going to allow us to achieve that mission for our members. So I'm proud to tell all of you, and everyone can relate to this, we have retired every legacy system. We have one data lake, and we have 21st century technology on par with all of the big guys with whom we compete. So that's a very important development for a regional plan to be successful. If you don't have strong technology where you can connect to everything, hang your customer service tools on, be in the cloud, you can't achieve that mission. So being focused on mission and then having that drive what you do. In terms of the community focus of our mission, we have created 15 neighborhood care centers that anyone from the community can come in free of charge, get a cup of coffee, have a glass of water, get help with what we're here to talk about in this important conference today, social determinants of care. Our team spends a significant amount of time helping people who are qualified sign up for SNAP, a number of people in the middle of New York City are hungry, and you can't really talk to them about diabetes if they're hungry, or if they need transportation, or they don't have a stable place to live. So our team does that. We offer classes. People can take a class on almost anything from chair yoga to Zumba to stress management, meditation, how do you use your cell phone literacy, et cetera. And we spend a lot of time on gaps in care. So that's sort of how clarity of mission has allowed us in our health plan to think about what did we need to prioritize to transform the plan. And we've rebuilt every part of our health plan, which I'm very excited about. So now we can emerge and tell that story, but also focus on our community mission.
You, as usual, are very humble because I think it's telling that those achievements have been under your leadership. And so congratulations on your new role.
Hillary Clinton said, it takes a village. That is the appropriate response. We have just a fantastic team. Two of my colleagues, or three of my colleagues are here today, so I'm very grateful that they came. And we have a stellar team. And I'm very, very proud to be part of that team. It's a team effort. Everything we've done has not been singular. Nothing has been singular, and it can't be.
Yeah.
You asked about leadership. It can't be singular. And if you get up in the morning and think that, just go back to bed and then get up again, because you can't do anything if you're trying to do it alone. And Raquel would say the same.
Yeah. So I want to segue into something else, which is 100 days. This week is amazing. 100 days of the Trump administration. Is actually the 60th anniversary for the Older Americans Act, the 30th anniversary for the White House Conference on Aging, which was amazing. And so when you look at everything happening now and you think about, particularly for us who are in healthcare, making America healthy again, where do you see the opportunities going forward, particularly the role of the health plans and working with community-based organizations?
Yeah, those are a series of very important questions. First, in terms of the Make America Healthy Again. I was reflecting on this on the way down, and we have spent decades in the healthcare arena, and we together have spent decades focusing on cost reduction, access expansion, quality. But on the quality side, it's largely been process measures the country has focused on. Here, shifting to the issues of healthcare particularly, I think it's important to think about that. I'm at the head of the line on taking sugar out of diets and taking dyes that are not allowed to be in food or other products in Europe out of our food and other products. I think those are important things that in the healthcare arena over the last 4 or 5 decades, people haven't prioritized the relationship between food and healthcare and what we can do to improve the food. Now, having said that, things like prevention, detection, medical research are very important for that objective. So we don't know yet where the budgets will end up. We've seen a number of proposals, but it's very hard to fathom if you take 45% out of CDC, and we know on the ground what that means in terms of just lead poisoning. You can go on, I can go on and on. We can make a whole session out of CDC, and I know Mandy is gonna be here later. If you take 40% out of NIH, I don't see, there's a lot that will be sacrificed. And I think our country, we have not sadly led in health, and we need to have the country be healthier. So I think that part of the aspiration is very important. But we do have the most important medical research apparatus, organization, and leadership in the world, and I think that is very important for this objective of keeping the country healthy. The bench research and the work that's being done in the academic medical centers and all around, I think the research labs, that's very, very important. So I think that if you want to push for a healthier country, which I think is very, very important, all the other pieces have to line up.
So just a quick follow-up on that, because what role, particularly with the health plans, do you see you're stepping in to an expanded role, a new role as a result of all the changes that you just outlined?
It's early, but I do think I've heard Dr. Oz reflect on the fact that improving health is going to be an important part of his agenda. And I think we've had real challenges in our country getting to value-based. I think there's a big problem, and a big barrier to that's been interoperability, but it hasn't really, the objectives haven't been as health-focused as he has implied he's going to set out programs to be. So to the extent we can compete on our ability to improve diabetes, improve congestive heart disease, improve disease, and make people healthier through various programs, whether it's the Innovation Center at CMS or some other place, I think it's a responsibility health plans should rise to and meet that challenge.
I do want to tell everyone, go to the Emblem website, because it really reflects a lot of what you're talking about. It's very impressive, the focus on wellness, prevention, and working in the community. So I just want to do a shout out that I read websites. If you don't, go for it. Emblem has an awesome website, so I strongly suggest you look it up.
You have just made a number of people, because we'll make sure that they all know back at home that you made that comment. You've made, I know, people feel 100 feet tall. Thank you very, very much for that. Thanks.
So I was speaking of the new political environment of which we're all existing today. Can you talk a little bit about, which I know is of great concern to the folks here, 1115 waivers, and particularly if you have any insights. I know we have a lot of people here from New York, what you think may be happening in New York?
Oh, well, New York has done, for those who are not from New York here in the audience, those who are in New York know this very well, has done something very path-breaking. They have recognized the fact that there are very significant social barriers to people getting healthy, getting into the system, staying in the system. And they received a waiver from CMS, the 1115 waiver. And we are in process, and many of the individuals who are leading this are here today, setting up social care networks that they've been set up, I don't mean to suggest that, but working with community-based organizations that are actually on the ground providing social services. This is an important recognition, a very, very important mission. The administration, sadly, has indicated that they don't intend to extend the waiver. So it will go till 27, which is a very short period of time because startup takes a little while. The one thing I will say also before I get to the point I was just going to make, New York also did something very, very important and laid out ways that health plans, social care networks, and community-based organization were all going to exchange data. There's uniformity there. And I haven't seen that in other kinds of similar proposals and operations across the country. This is important because if organizations can't talk to each other through technology, it's very difficult to track the progress, et cetera. So I think New York has done something very, very important, and the social care networks are doing something very, very important. Thinking ahead to what happens after 27, I think that the health plans have a real leadership opportunity to work with social care networks and community-based organizations. Our neighborhood care centers have been qualified as community-based organizations because of the nature of what we do. but working with others, working with the social care networks, to discuss and determine how do we take forth what has been developed so it doesn't end in 27. Because if you think about people who have barriers to getting into the system or staying in the system, think of a huge wall which is difficult to go over or go around. And that's why I'm so enthusiastic about what New York has done. In the administration Trump won, they allowed us some flexibility to actually bring certain services, social services, to beneficiaries in Medicare. And I'm hoping over time that through the work that New York is doing and other states, that people will be able to look to see progress and why it's an investment now to actually getting progress down the line and actually reducing costs and improving access. If someone doesn't have a stable home, you really can't hope that you're going to help with their healthcare concerns. Once you can address that, then you have a shot at helping them with their healthcare concerns.
So I have a follow-up question. And I hear this a lot from nonprofits and community-based groups, which is, I want to work with health plans. I think Medicare Advantage is one that comes up all the time, particularly. They don't know, how do I access a plan? How do I get entrance into it? How do I establish an appropriate value proposition? So what are your suggestions to the folks out here?
Okay, well, in New York, we have the advantage of the social care networks being established, and they have very strong relationships with health plans. So it's going to be a little easier here. For people who are not in New York, email the CEO and of a particular health plan. If you're in a state where the Blues are dominant, email the CEO about what you provide, why you're important to the community, and how you can help them serve their members. But go to the top.
I love it. Remember, quote Karen when you do that, you know, it's...
Absolutely.
Yeah.
People respond to emails, and as they should.
Well, and I agree, because as one who's worked for some CEOs, when they get those emails, it's like, okay, get on it.
Yeah.
You know, so lesson learned. So thank you. I appreciate that. One of the other things that I wanted to discuss with you, which I think it has been challenging for people about how to position it, what to say around it, is around health equity. And particularly diversity. I do know, for example, I live in Nashville, Tennessee. Our Vanderbilt was actually told to eliminate any research dealing with diversity and equity. So it's a very sensitive time. Can you share your perspective or wisdom or thoughts about how to move forward?
And I hope this is helpful. First, point number one, we have significant disparities in healthcare. That has been well documented. Whether we're talking about a white individual in rural America, a Black individual in the inner city, a Hispanic individual in the suburbs, we have very specific disparities. And you can't improve healthcare without addressing those disparities because, and we're actually now have changed our whole approach to care coordination, care management because of the recognition of disparities. And you can't possibly hope to move the needle if you're taking a state-based approach. You really have to get down to the zip code, and that's where technology is so important because people have different characteristics in certain zip codes. I think the health community broadly hasn't spent enough time educating about disparities. So to people who are not in our communities, they could hear this concept of health equity and think, oh, someone is getting something I'm not. But the reality is that individuals are behind in their access, behind in their preponderance for certain diseases and so on and so forth. And I think the recognition of that, attacking disparities, is fundamental to actually having a prayer at achieving the goal of health equity. And that's where it starts, but I think if you start on the other side and talk just about health equity, people who aren't in the healthcare arena, or maybe people, maybe in a more political environment, it's missed, this concept of strong, significant inequities. And if we are going to make the country healthier, we have to attack those inequities. So that's sort of how I think about giving voice to what can't be left behind as a goal.
So I have to do a follow-up on this. Have you changed your terminology at all?
We've always talked about disparities and attacking disparities, and we'll continue to do that because it stares you in the face when you look at the data.
Well, I don't know about that, right? Let's applaud Karen for her work there. Seriously, that is awesome. Thank you, thank you. I want to switch and maybe kind of combine a little bit of this. Brian Thompson was actually shot here in New York. And, I think so many of us thought it was so horrific, but it was just amazing to see that the individual who shot him was almost like a hero. And I do know as part of that, prior authorization has come up and a lot of anger from people about access and services from health plans. What's your view on that?
It's really hard not to get emotional about someone you knew. And I had the pleasure of meeting Brian on a couple of occasions, getting gunned down in the middle of New York City on a morning that was a regular work morning for all of us. It's very hard not to get emotional about that. I think anyone in the healthcare community, in the banking, the real estate community, anyone in New York would have that same response first off to you. You're right, what that uncovered was an explosion of concern about prior authorization and utilization management. And it made us step back and really think about the why this reaction and what we could do to ease the minds of individuals about how we work. And you will remember during the Affordable Care Act, we were at a similar point in time. And people who weren't involved in it perhaps don't know it or remember it. But it was a time when the health insurance industry was really under a spotlight for practices that individuals found quite concerning. And in the health insurance industry, we decided to step up and do what associations rarely do, which is to be part of the solution as opposed to just saying no. And you never lose your job in Washington by saying no, but it's quite a different kettle of fish to say yes and then figure out what you're going to do to help things, a debate proceed. So that has given me a prism through which to look at this. And I think what we need to do in the health plan community is be much more transparent about why do we use these tools? So why do we prior authorize? We prior authorize because we see practices that are not in sync with the scientific evidence. Well, how do we know that? Because we use Physician Specialty Society guidelines to guide what we do in prior authorization. Not a person outside this building would know any of that. Also, I think it's very difficult for people to understand what those guidelines are. Where do they come from? So we need to be more transparent about that. We need to be more transparent about what's coming in. Utilization management allows us to screen out duplicate claims. which explodes costs, and sometimes providers are busy, they send duplicate claims, fine. You know, our technology allows us to screen that out. Things that are not in sync with scientific evidence and things that are unsafe. So prior authorization was started as a safety mechanism, but it's time for the health plan community to actually emerge and talk much more specifically about this. We, for example, at Emblem, regularly drop prior auths that if we see things that we're approving 95% of the time, we drop the prior auth. We do that regularly. And it's important for our members, our customers to know that, to understand that we just don't put barriers. We talked about social determinants as barriers. We don't just put and use prior auth as barriers. But it's very, very rare, sadly, to see the health plan community straightforwardly discussing this. And I think, you know, maybe because of where I used to sit and what I used to do, it is time now for the health plan community to emerge and talk much more specifically about why we do what we do, what would be the costs of us not doing it. Sadly, some in the provider community have a real campaign, pay first, ask questions later. If you want to explode healthcare costs, that will be what people do. So again, it's incumbent upon us, I think, to really be much more transparent on that issue. I'm sorry to go on.
Yeah, no, I think that's excellent insight, and I know Arkell is going to get very upset with me, but it sounds also like
And we definitely don't want that.
Healthcare Choices, which I actually take to every physician that I see. I think there's almost like a two-pronged aspect of this, which is the health plans educating,
yes,
and the consumers also engaging in their own health care, yes, and being accountable for asking good questions and engaging as a partner with the healthcare system.
Well, just to give a shout out to Arkell, she was always willing to talk about what we do, why we do it, and what's in the public interest, frankly.
Yes.
But Arkell, we need more of you.
So have you been worried about security as a follow-up to Brian?
I think every person in New York who's doing in one environment or another, you know, just that incident was just an awful incident.
Yeah, it must be terrifying. I was at an event with health plans, and almost every single CEO brought a security guard with them, and they had security at the event also. So I think when you have one-on-one conversations with people like you, it is just telling that we don't know how to communicate. No. And I think there's a real opportunity there.
And that goes back to your first question about leadership.
Yes.
Communication is really important for leaders to be able to lead successfully.
And just so everyone knows, although she won't take credit for it, rumor has it, for those of us who were in DC during ACA, it would not have been passed if it weren't for her leadership.
Oh no, it was.
Yeah,
no.
A lot of people may have been involved, but this is the only woman, I have to tell you, I would walk into rooms where people are just shouting and yelling and never on the same page, and she just is so calm and brought such a sense of, let's get together and come up with a solution. You're very solution focused, so it was very commendable. You don't have to take credit. I give you credit.
Well,
so.
but I will say, and President Obama used to say that this was his mission. He wanted to complete the job that was started by Lyndon Johnson. And George Bush did something very important on Part D, but President Obama was very, very focused on finishing this job. And so many people now have access to health care that never had access to it before, working families in particular.
Yeah, agreed. So we now want to take some questions from the audience. Karen said nothing is off limits, as you can tell. I have no problem asking her questions. So Eric, are you bringing me questions, or how are we doing this?
I do have a
Where
question.
are you? I can't see you.
I'm all the way up here. I'm in the back. So we do have a question.
Way back. Oh, okay. Way in the back. Okay, questions.
So from the audience, I'm curious from EmblemHealth's perspective, how do we continue supporting communities with social care needs once the 1115 is done?
Yeah.
Okay. I think that's where I go back to thinking about the role of health plans. If you think about it, we are the only entity in the healthcare establishment that sees people in every encounter in the healthcare system. We see them on the physician side, on the hospital side, on the pharmaceutical side, in the nursing home, I can go on and on. So I think that we are well situated to play an important role. In New York, we're going to have the benefit of the social care networks that are established, but to be able to deliver on this mission of making people healthier, and that's been our mission since I walked in the door of EmblemHealth. To do that, you really need to deal with social determinants, which is why we invested in our communities in the way I described. But I think it's probably strange for some, not in the health plan community, to hear me say that, because we wouldn't be on the top of everybody's list in terms of people who can come in and help save the day. But the truth is, I think we can be a very important part of the solution. And I'm confident that in New York, the state and the public health networks and Oxiris, who's here, who's speaking later, who's bringing everybody together, will start the conversation about what's next, because we don't want to wait till 27, certainly.
Eric?
So one more question is, I would love to hear about Vicki Shepard's connection to the silver sneakers, which helps me as a wheelchair user.
Say that again. I didn't. Your connection to silver sneakers. Oh, but my connection to silver. Well, number one, I'm going to be 75 in July, so I do have a gym membership. If you are, whether you're fee for service or Medicare Advantage, I strongly recommend exercise. Karen works with Silver Sneakers. So Silver Sneakers is a program with Tivity Health. And there are 19 million seniors who are on Silver Sneakers who are eligible through Medicare Advantage. I think the power, and they work with 65 health plans, 15,000 different locations, and the type of programming, you can do it now in your home, or a lot of the sessions that are established now, even like at YMCAs or senior centers, include the ability to do exercise from a wheelchair. They've also found that exercise is very good for brain health and dementia, that there's a direct correlation between people who are engaged. So it isn't just the exercise, it is also the social engagement that is associated with it, and a sense of pride when you exercise and you're taking care of yourself. It's just amazing, the difference. So I just left Tivity Health after 20 years, and now am starting up a nonprofit for the Healthy Aging Coalition. And so it's a program near and dear. Tivity invested a lot of money in the Healthy Aging Coalition. They continue to be a partner, and I truly appreciate that.
One of our most successful programs at Neighborhood Care is, in fact, chair yoga, where individuals with mobility issues actually really thrive by taking the classes, which you can do in person or online.
Yeah,